authorities say the incident is capable of tarnishing the hospital's image. According to a statement issued by the hospital, 2 officers were caught by the BBC's investigative team, Africa Eye, selling personal protective equipment, PPEs, belonging to a private individual within the premises of the hospital. The statement says, as a hospital, it does not encourage this behavior since it may adversely affect its output and also be misconstrued by the public as items belonging to the facility. The suspended officers are Thomas Osei, medicine counter assistant, and Divine Kumoji of the sewing unit of the hospital. Thomas Osei is serving a 2-week suspension without salary for inappropriate and unauthorized sale of PPEs on the hospital premises, and Mr. Divine Kumoji as well. Now, the statement, Mr. Divine Kumoji, the statement said would refund all monies realized with regards to unauthorized and inappropriate sale of face masks on the hospital premises. He's also serving a 2-week suspension without salary. Dr. Emmanuel Srofenyo is medical director of the hospital and joins us via Zoom. Dr. Srofenyo, good afternoon. Now, the investigative piece you talk about will be broadcast today. So on what basis have you taken this decision?
Good afternoon, and good afternoon to your listeners. I want to say that I thank you for inviting me to clarify this issue. The basis is that these officers we have been communicated to by the BBCI team as to what they found from their secret cameras. And then immediately this information got to us, we set up an investigative committee that went into detail to find out the circumstances surrounding their behavior, what they did, and so on and so forth. And it came to light that when they were approached, they went to town and purchased PPEs from some dealers and brought these materials to the hospital premises and sold. For us, we accuse them of the fact that this is a private business that they are engaging in, but this should not be done in the premises of a public institution, because this is a public institution. People might construe that to mean that, yes, they were siphoning from the hospital stock. When we investigated the hospital stock, all donations and then the PPEs that the hospital itself has bought are all intact, and that this one was brought from outside. And indeed, we went ahead and even contacted the dealers outside, and it engaged. It's actually confirmed that they bought the PPEs from outside. However, for doing what they did on the hospital premises, we have brought them to book, and that is why we have suspended the 2 of them for a period of 2 weeks, during which they will lose their salaries. And the other person was also to lose all the revenues that he got from this will be taken away from him. Thank you.
Why is it just one person who is refunding the revenue?
It is because that other person, because he works in sewing room, he claims that he used the hospital, he claims that he used his own materials and then his own spare time. But this is something that we were unable to confirm whether it is his own material or not. And that is why we decided that we would take every revenue that he realized away from him. But for the other one, we have the evidence clear and cut that he got it from outside, and that he actually paid, receipted, and the company's name, registered company, and all that. So for him, his crime is that he did a personal business on public institution premises. And so that is why we have some differences in the punishment that has been meted out to them.
Help me clarify this, Dr. Srofenyo. So for Divine Kumoji, he claims he sold the PPEs himself.
Yes.
With what material?
He claims he sold the PPEs himself with materials that are left over. That is why he claimed materials that are left over from what the hospital itself has done. You know, in the event of this pandemic, one thing that the hospital has done was that we engage our sewing room staff to sew cloth face masks for the staff to use. And we so designed them in such a way that they are peculiar to what Rich Hospital uses. And so definitely in situations like the leftover cloth pieces are left, and he is saying that he gathered those ones and used his own spare time on weekend to sew them, and that is why he sold. And the investigation has also proven that yes, those are the materials that he used. However, for doing what he did and using leftover cloth from the hospital without any official permission, that is why management has taken the decision that whatever amount of money that is realized from this will also be taken away from him.
Forgive me, Dr. Shofenyo, is he not stealing from the hospital? This is material that could clearly have sewn new face masks, and the hospital procured for the intention of sewing face masks, and he made his own face masks and sold them. Is it not stealing?
Yeah, so there is a malpractice there. That is, even if you are picking leftover materials to put together, you still need a permission. You still have to ask permission from the unit in charge and also from the head of the department. And so for not doing this, that is why we regarded this as a malpractice.
Are we handing over the case to the security services? Is the police going to look into this?
Yes, after the investigations, Ghana Health Service has its own code of conduct and disciplinary measures. So normally after investigation like this, we submit them to the dictates of the code of conduct and disciplinary measures. And this has been duly done. The particular error that was committed, the punishment that you need, that has to be meted, is also prescribed by the Ghana Health Service Code of Conduct. And that is what we did. If further investigations show a criminal intent, then the police will duly be informed.
Dr. Shofenyo, thank you very much for joining us this afternoon on Joy News Today.
Thank you also.
Away from that story, the police have intensified investigations into violent clashes between the supporters of the MPP and the NDC at Nkran Kwanta in the Doma West district of the Bono